Hello to all dear students. In this video, we'll be discussing about a small introduction regarding biostatistics. Now, the name biostatistics itself it consists of two parts, where bio, as you people know, means of life or living things, whereas statistics, it is a branch of mathematics dealing with the collection, analysis, interpretation and presentation of masses of measurement. So in total you can say biostatistics means when we use the statistical tools on the biological problems and derive some results about it. Next, in biostatistics we generally want to study a population. You can think a population as a collection of persons, things or objects under study. Now to study a population we select a sample. The idea of sampling is to select a portion of a larger population and study that portion to gain the information about the population. So this is sample. Next, we'll have a simple example for better understanding about population and sample, and meanwhile we'll study a few more terminologies of the biostatistics. Now as you can see, these are gulab jamuns. So we have got 100 gulab jamuns. Imagine a cook prepares 100 gulab jamuns, and after preparing 100 gulab jamuns, he wanted to taste them. So he tasted 2 jamuns. Now you think, what is the population and what is the sample over here? Yes, the 100 gulab jamuns will become the population and sample will be the 2 jamuns which are tasted by the cook. You know, the same thing even we'll also do. Like suppose if you want to buy any sweet like jalebi or laddu, we'll ask the shopkeeper to give a sample piece, and after tasting the sample we'll purchase 1 kg or 2 kg and so on and so forth. Because basically it's from the sample piece we'll get the idea of the entire stock. So similarly happens over here also. Now what this cook wants to check? He wants to check the softness and sweetness of the gulab jamun. So this will become the parameter. Okay, now you understood, you got 3 terminologies: population, sample and parameter. Now these gulab jamuns, they may be soft or they may not be soft. They may be sweet or they may not be sweet. Now there can be either probability. So there is a probability in these parameter, and this variation is known as variable. Okay, so you came across another thing, that is variable. So the parameter have got a variability. Parameter was softness and sweetness. So variability is they may be soft, they may not be soft. The jamuns may be sweet or they may not be sweet. So this is a variable. Variables are the measurements, the values which are characteristics of the data collected in experiments. These are the data that will usually be displayed, analyzed and interpreted in a research report or publication. Like instead of this gulab jamun example, if suppose you are doing any kind of experiment of checking the blood sugar level, before giving a drug and after giving a drug, suppose you need to check the blood sugar level. So you collected the blood sample and you checked the blood sugar level. So whatever data you got, that will be a variable, right? In statistical terms, these observations are more correctly known as a random variable. Random variables take on values or numbers according to some corresponding probability function. But because these measurements may take on different values, repeat measurement observed under apparently identical conditions do not in general give identical results. That is, they are usually not exactly reproducible. As you can see an example on your screen itself. Whenever you are weighing anything on a weighing machine in your chemistry lab, before some reading will be there and within a minute the reading will be changed. So this is a kind of variable. Now taking the example of the gulab jamun, we'll try to make out few terminologies of the biostatistic. Like population, we know population is the 100 gulab jamun. Sample will be the 2 jamuns. Next, parameter, what was the parameter? We needed the cook wanted to check the softness and sweetness of the 100 gulab jamun. Next, what is the statistics over here? Statistics will be softness and sweetness of the sample. Means the cook tasted 2 jamuns. his observation about 2 gulab jamun he knows. So observation or finding of the 2 gulab jamuns, that is the sample piece tasted by the cook, will be considered as the statistics, because basically whatever idea he will be getting from the 2 gulab jamuns will be applied to the rest of the entire population of the 100 gulab jamuns. Next variable will be the softness and sweetness, means it may be soft, it may not be soft, it may be sweet, it may not be sweet. And next will be the data. Data we don't know. Data will be with the cook who tasted the 2 gulab jamuns. But we can say jamuns might be tasty. That's the reason why he tasted 2 gulab jamuns instead of 1. Okay. Next we'll have another example. We want to know the average amount of money spent on people aging 60 years old and above on medicines each year by families at Bangalore. We randomly surveyed 100 families with old age people aging 60 years and above in a society. 3 of them had rupees 60,000, 75,000 and 95,000. Okay. So what does this problem means? First of all, we need to understand about these all statements. Like in a Bangalore city, we need to check the families. We have got n number of families in Bangalore city, but we need to consider those families which have got people aging 60 years and above. That means grandparents. So any families in the Bangalore containing grandparents, that will become our population. So what we need to check? We need to check the average amount of money spent upon these grandparents every year upon their medicine. Okay, so we can read over here. We want to know the average amount of money spent on people aging 60 years old and above on medicines each year by the families at Bangalore. Okay, so this is our population. What is our population? Population will be families of the Bangalore that have grandparents, because obviously grandparents will be aging 60 years and above, isn't it? Now what we did, you can read out. We randomly survey 100 families with old age people. So 100 families will become our sample, and we have got 3 of them had 60,000, 75,000 and 95,000. Now we shall check out all the biostatistical terminologies over here. As you know, population will be all the families in the Bangalore with grandparents. Our sample will be, yes, 100 families in the Bangalore with grandparents. That will be our sample, which sample we are serving. Next, what is the parameter? What is the parameter? You just you also run in your mind the example of gulab jamun also. Parameter will be, yes, average amount of money spent on the grandparents upon medicines each year by the families staying in Bangalore. Next, what is the statistics will be here? Yes, statistics will be the amount of money spent on the grandparents of these families in the sample. Okay, sample means 100 families. Whatever 100 families we surveyed, what was the average amount of money spent on the grandparents? That will become our statistics. Next, what is the variable? Variable will be the amount of money spent by one family. And next, what is the data? We have got data of 3 families, that is 60,000, 75,000 and 95,000. Okay, so this is how we can group all these things. Next, we'll have one more example. We want to know the reading skills of 10-year kids of Delhi. We randomly surveyed 2 schools. 2 kids had very good and one had average reading skill. Okay, now you say what might be the population over here? Yes, population will be 10-year-old kids in Delhi, which is a very huge number. So we are selecting a sample. What is the sample over here? Sample will be the 10-year-old kids from 2 schools. That will be our sample. Now, is this sample really relevant? See, our population is all the 10-year-old kids, and sample we are selecting is 10-year-old kids from 2 schools. Just look at the population. Population will be all the 10-year-old kids of the Delhi, isn't it? See, not all the 10-year-old kids are school going. There are some unlucky 10-year-old kids that are working as labor or living in slums or villages where education is not provided. So if our population is all the 10-year-old kids of Delhi, then our sample should include both school going plus not school going kids. Or else better to change the population itself. Why don't we give population as 10-year-old school going kids of Delhi? Then our sample will be Correct. 10-year-old kids from two schools. This will be more relevant, isn't it? See, the sample should be relevant to the population, and this thing is very much important in the biostatistics, because if our population is all the 10-year-old kids, means we need to select the sample both school going as well as non school going, isn't it? Next, everything will be simple. Parameter will be the reading skill of 10-year-old school going kids of Delhi. Statistics will be reading skill of the sample, that is reading skills of the 10-year-old kids of the two schools which we are surveying. What will be the variable? Variable will be the reading skill. And what is the data? Data what we got is two kids have very good and one have average reading skill. This is the data, and this is how we are doing the thing. Next thing is, what is the role of biostatistics in modern medicine? Now this is the main topic of discussion. Now see, most people have heard the statistic that heart disease is the leading cause of death in America. But how do we know this fact to be true? Where did this information come from? See, back in 1948, when a lot wasn't known about the factors leading to heart disease and stroke, a health research study known as the Framingham Heart Study was being done on 5,209 people living in the town of Framingham. These participants hadn't developed any known symptoms of cardiovascular disease and hadn't had stroke or heart attack. They agreed to be followed over a period of time to help researchers learn what factors lead to both the condition. The study was landmark in several ways. It showed there was no one cause for getting a heart attack, and combining information about several risk factors could estimate the risk of someone getting the disease. A very thanks to Framingham study, which is still going on today. We now know the major risk factor that lead to cardiovascular disease. And to reach these conditions, researchers simply followed the numbers, the biostatistics numbers to be the exact. So this is how we can use biostatistics. Next, we can use biostatistics even in epidemiology. Now, when we hear statistics like 1 in 8 women in the US will develop invasive breast cancer over the course of her lifetime, or that the risk factor for breast cancer are family history and age, we know that biostatistics were instrumental in coming up with these conclusions. Biostatistics is used extensively in epidemiology. Next, there is also importance and role of biostatistics in clinical research. It was Mr. Charles McCullum who was the professor and head of biostatistics at the University of California in San Francisco. He says that virtually any medical research study uses biostatistics from beginning to end. Statisticians help medical researchers design studies, decide what data to collect, analyze data from medical experiments, help interpret the result of the analysis, and collaborate in writing articles to describe the result of the medical research. Before, in 1950s, medical research was on observation basis. Next, during the mid 1950s, it was by Dr. Paul Meyer, who was a leading medical biostatistician, introduced to the world the word randomization. Randomization means it is a technique where researchers randomly assign one group of patients to receive an experimental treatment while another group receives a standard treatment. Randomization helps researchers avoid mistakenly tampering with the result by choosing healthier or younger patients to try a new treatment. McCulloch says most people don't realize how important biostatistics is to their own medical decision. For example, you may wonder if that new drug from the pharmaceutical company really works as if it is all the hype, and a home remedy might be as effective. See, this biostatistics helps to design clinical trials to make sense out of the data and help you draw the conclusions whether your home remedies will work or not. Next, we'll examine the role of biostatistics in cancer research. Biostatistics is important in finding treatment for new drug for disease like cancer. Cancer therapies tend to be very toxic. If you are a patient and the usual therapy hasn't worked, you are desperate to find out any therapy that offers hope to put you in a remission. Biostatisticians look to the design a study that tests a few patients as possible and gets them off the drug quickly. So if they aren't working, they aren't subjected to the harmful side effects. All the while, the goal is to find which drug work and ultimately reject the therapies that don't. See, biostatistic itself is not going to cure the cancer. When you do a study where the objective, when the aim is to cure cancer, you are able to answer questions like, does something new works? Or can I get something over that's going to be just as effective? So this is how you can use biostatistics, and this was all regarding today's video regarding an introduction to biostatistics. I hope you people found this video helpful. Thank you for watching.